yes, but before we get to that, I think it's important to the ultimate holy grail is preventing ACL injuries from happening, right? So we know that if we do the right kind of program at a high enough frequency and the stress is enough and it's sport specific enough, we can actually reduce the risk of having these actually happen in the first place, which would, if we can reduce that, like we're moving the needle forward in healthcare. And I know Dr. Pesci probably agrees with that 100%. Prevention is the ultimate key. When you can't prevent, you want to make sure you can uh, repair and reinforce and try to get them back exactly or as close to exactly as they were pre-injury. So 100%. Prevention. If you can't prevent, then you come up with the other solution, which I think we've done a really, really good job with. You know, you can compound the interest of healing if you use your own body cells to stimulate and cause healing to happen a little bit more, I would say, rapidly, but also from what you mentioned before is along those lines of stress, right? You get that stress of that ACL, that graft, probably better. There's not a study to say this, but from our experience, we at this point, if you're going to do a bear surgery with us, we're really advocating very strongly that you're going to do a bone marrow aspirate or a PRP injection as well, just because we want to stack the odds in these individuals' favor. Like we're not going to take a cookie cutter approach or we're going to do this and set it and forget it kind of thing. Like we are very integral from soup to nuts, from start to finish. We oversee all of our bears, even if they're done all the way in the Netherlands, or we've talked to people as far as Australia about these things, and that's the one thing that we stand by is our outcomes. And we will not do anything for anyone if they're not going to fall in line with kind of what we need to happen, because at the end of the day, getting a person back on the field and or doing the things they want to do, or even just maybe playing with their children or skiing and all those things again, that's the ultimate win for us. And we know we have a formula in place that gets in there and gets them back as fast as they can, but as safe as they can. So the surgery is great. Surgery works on itself. We know that the regenerative medicine works. It can work on itself. We know that PT, or what we call V-fitness, because we take a more comprehensive approach than traditional PT, we know that works on itself. We know things like laser works on itself. Now, if we combine all those four things together and we create like a really robust, stringent program for an individual, we know that our outcomes are going to be far superior to anyone else's out there, because we are combining all of those aspects, and those are things that we specialize in here, and we tweak everything based on the individual. So